Hello again. Menstrual Hygiene Day is observed on the 28th of May each year, coinciding with the International Day of Action for Women's Health 2022 across the world. The day highlights the importance of menstrual care and raises awareness about the social issues faced by women during menstruation and those who don't have access to sanitary products. In developing countries, women's choices of menstrual hygiene materials are often limited by the costs, availability and social norms. Adequate sanitation facilities as well as access to feminine hygiene products are one of the solutions that are being offered by various organizations. We're joined now by Dr. Ntsiki Manzini-Matebula, Program Specialist of Sexual and Reproductive Health Rights and HIV UNFPA South Africa, and Siphiwe Mathoba, Director of Social Empowerment and Participation of Women, Youth and Persons with Disabilities on this conversation. A very good afternoon to both our guests, and thank you so much for joining us. Dr. Matebula, let me start with you. So this year's theme is making menstruation a normal fact of life by 2030. Is it already not a normal fact of life?
Good afternoon, and good afternoon to the viewers. Well, the reason why we are saying making menstruation a normal fact of life is that whilst it's a natural occurrence, what we found is that it's still, shrouded in secrecy. There's also taboos around menstrual health. So we feel that the conversation and the awareness around menstruation is not really a normal fact of life. So it's very important for us to continue to have this conversation and to advocate for menstruation.
Mr. Mathoba, how would you characterize the landscape in South Africa where this issue is concerned, particularly in the most remote areas in the country?
Thank you, Dudu. Greetings to Dr. Manzini as well as to your viewers. Yes, this is a matter that is really receiving a lot of attention at the moment, because we've realized that we as government cannot just sit whilst we know that in most public schools, especially in quintiles 1, 2, 3 schools, which are no fee paying schools, farm schools as well as special schools, there are learners that are not able to access these well needed menstrual products. So our intervention is really to ensure that there is uninterrupted learning. Learners, in particular girl learners, attend school without having to be overtaken by boys. That means ultimately being overtaken as well as in the boardrooms of government, private sector, non-governmental organizations later in life. So we want to equalize a situation whereby education is accessible, is uninterrupted for girl children. That is why, therefore, we've embarked on a sanitary dignity program to roll out free menstrual products to those categories of learners in public schools.
Please expand on the sanitary dignity.
Because of the need.
Mr. Mathoba, if you could please expand on that program, the Sanitary Dignity program. How does it work? A young person recently asked why we have condoms available freely, yet we do not have, still in 2022, sanitary products that are available at public toilets, for instance.
That is a good question, and that is a good observation from the young person that we're speaking with. We are on our way to ensuring that we reach as many women and girls as possible. But of course, it will take an incremental kind of process because of budgetary availability. But at the moment, government has done quite a significant amount of input into that, because in the 2021-22 financial year, about 4.6 million learners in those quintiles, 1, 2, 3 farm and special schools have received menstrual products, in particular sanitary pads. And also beyond just what the Department of Women, Youth and Persons with Disabilities is doing, also in post-education and training institutions, that is universities and TVETs, NEFSAS beneficiaries, which are about 250,000, are receiving stipends to the amount of 290 in order to buy incidental items like menstrual products, as well as female inmates in correctional centers, that is in prisons. Women receive free sanitary pads. Also in public hospitals, in psychiatric and maternity wards, women do receive free sanitary pads. And lastly, child-headed households through the social distress of relief items to the Department of Social Development. Women also, or rather, women and girls receive free menstrual products. So there's quite a range to do at this stage. Of course, we can always extend it further with budgetary allocations favoring us as the years go by. But indeed, government has actually put a big dent into this. But of course, like you have indicated, we need to exactly upscale our program.
Dr. Manzini-Matebula, you spoke a little bit earlier on of secrecy and taboos, stigma associated with this. What are some of the examples that you can give us that you've observed from the work that you do?
Well, I think really around the stigma, for example, sometimes we've been told that girls shouldn't participate in social activities when they're menstruating. At times they are isolated, and those are the kind of stigmas and that you will find that we grow up knowing, and also that perhaps, for example, when you start menstruating, there's this perception that you've already started engaging in sexual activities, which is not always the case, So, and when young people obviously don't even know about menstruation, because what happens, we've found, is that young people start having their menstruation and are clueless about what it is. And so these are some of the things. I mean, I know even those certain things about the do's and don'ts of menstruation. If you socialize with boys, and sometimes parents don't even tell you correctly what they mean when they say but in actual fact they are telling you that you shouldn't sleep with boys, and you will think that they mean that you shouldn't mix with boys, when you're menstruating, but it has a different context. So we don't even talk about it directly, and more so that you find that we don't have enough information even about the products and even about the menstrual cycle. So those are some of the issues that we really need to raise awareness on and prepare young girls and menstruators, long before they start menstruating, so that they're able to manage their menstrual cycles effectively.
How do people help themselves, help these young girls and boys, especially when we talk about the stigmas and we talk about the taboos, to give them not only the right information, but to not make this something that is seen like you've got some disease? Dr. Manzini, that's at you, please.
Okay, sure. All right, thank you. Well, I think we really need to have these open discussions, have open communication about menstruation. I think for me that is the starting point, that when you have young people, both men and boys and girls, understanding what puberty is about, understanding about their bodies, and then also understanding about menstruation. That is really the starting point. But also beyond that, you've got communities, you've got parents, even parents can't talk about menstrual issues. And for me, I think that's a big factor, because this is where a young person can really get a lot of information, but even parents are not informed about it. Even their own parents didn't talk to them about it, so you really need to break this taboo about talking about menstruation. That is the starting point, and then really ensuring that you raise awareness and the stigma, breaking the stigma. So it's really around social norms and how we socialize young people when it comes to menstruation.
A big thank you to both our guests for joining us this afternoon. Dr. Ntsiki Manzini-Matebula is Program Specialist of SRHR and HIV UNFPA South Africa, as well as Mr. Sipiwe Matoba, Director of Women, Youth and Persons with Disabilities.